This is the lumbar plexus, so between L1 and L4. So you have a few different nerves here. One is called iliohypogastric. So this has sensory and motor. The motor of this nerve is similar to ilioinguinal. So it's supplying transversus abdominis and internal oblique muscles. So this area. So the motor function is the same between these two nerves. The sensory of iliohypogastric is that it is supplying the suprapubic area, which is this area, and also this area, which is the lateral gluteal, so which is this area. So from here to here is supplying the skin of that area. The ilioinguinal and genitofemoral sensory is the same. Okay, look at the name. So genitofemoral, so supplying the genitalia and also femoral area, which is this part of the thigh. Femoral is the whole area. This area is called femur, but this is the upper medial thigh. Okay, so that's supplying this area and also the genitalia. So both of these two nerves, sensory innervation is the same. Motor innervation of ilioinguinal is the same as iliohypogastric. Genitofemoral also causes innervation of the motor muscles of cremaster. This is mainly in male, and let's not talk about it for now because you have to know some other functions in male genitalia. Femoral nerve is a big nerve, so this is the biggest nerve in the lumbar plexus, and that is supplying the quadriceps muscles. Okay, so quadriceps muscles, if you remember, cause extension of the knee. Also cause iliopsoas muscles, so supplying iliopsoas that can cause flexion of the hip and also cause flexion of the lumbar area, and sartorius, if you remember the sartorius muscle, which is running oblique, and that's also cause flexion of the hip and the knee. It also supplies the sensory, the skin area of anterior thigh, medial thigh, and medial leg all the way to the medial foot. Okay, so like this medially, but for the thigh area is also supplying anterior part of it. Lateral femoral cutaneous nerve, this is only sensory, and that is, the name is very obvious, so it supplies the lateral part of the thigh. And obturator nerve, this is supplying adductor muscle, so cause adductor muscle. Gracilis is also an adductor muscle, and that is called adduction of the hip. And sensory is similar to ilioinguinal and genitofemoral, which is supplying the upper medial thigh. Sacral plexus is L4 to S3, or S4 actually, L4 to S4, and it has a few different nerves. One is called superior gluteal, and that's supplying all gluteal muscles except the gluteus maximus, which is supplied by the inferior gluteal nerve. The pudendal nerve is supplying the pelvic floor muscles and also the skin of the pelvis, which is part of the genitalia and anal area. Posterior femoral cutaneous nerve, so that is supplying the back of the thigh. This is sensory only. The sciatic nerve, this is the biggest nerve in the body, okay, that runs posteriorly, and then it divides into two different nerves, so that the tibial nerve and the common fibular nerve. The common fibular nerve has sensory and motor, and also tibial has sensory and motor. So the common fibular is supplying the anterior and lateral leg muscles, and also a little bit of the dorsal foot muscles. Also it supplies the skin of the anterior leg and the dorsal foot. The tibial nerve, it is supplying the muscles of the back of the leg, and also the muscles that are located in the plantar surface of the foot. The skin is the lateral and also the dorsal or posterior part of the leg, on the plantar surface of the foot. Sciatic nerve also supplies quadriceps muscles in the thigh, which cause flexion of the knee.